All right, everyone. Good morning. Chris Calabro here with CPC Wealth Management. I want to thank you all for joining. Very important webinar today regarding Medicare. I have Mark Brownstein on, who's going to be presenting. Mark and I have worked closely over many years. He's serviced many clients of CPC Wealth Management, and he's giving his time today to go over some very important updates, changes, and details regarding Medicare. So, Mark, thank you, and the floor is yours.
Well, thank you all for attending. Thank you, Chris, for inviting me. It's always a pleasure to educate anyone and everyone about Medicare. The changes are um, small, medium, and large, depending on who you are and how much you utilize Medicare. Even if you're not on Medicare yet, and you may someday be on Medicare, I think some of this information is certainly relevant. So I'm going to speak for about a half an hour. Type in questions in the chat if you have them. Um, Again, just to let you know, we're based out of Nyack, New York. We have a staff of 7. We support about 3,000 clients in 30 states, but my core business is likely Massachusetts all the way down to Maryland. And this is our busy season. This is when people are evaluating their plans going into the new year. But for some of you, you may be on Medicare. For some of you, you may be looking to go on to Medicare. So I'll try and address both of those opportunities in this conversation. Um, and so I built my career in healthcare. I've been doing this on and off different areas of healthcare for 30 years, 10 years as principal of this Emerald Medicare firm. But I support individuals, CPAs, financial planners, case managers, social workers. So I'm very involved in my community. I love educating people. For Montefiore, Nyack, and Montefiore in general, I'm the sole independent resource and very involved in the community. I love educating people. But people actually shout from the rooftops about questions around Medicare, whether it be Part A, Part B, Part C, whether it be about these advantage plans and Medigap and penalties. That's what we're here for. Someone needs to be able to guide you as an independent person looking out after your best interests. It's about the fiduciary responsibility that we have. I'm not going to go through the agenda. Medicare, just briefly, started being thought about it in 1945, but it was really Lyndon Johnson who put it into law. It's still in the same Part A, hospital coverage. Part B is all the outpatient doctors, specialists, x-rays, diagnostic. But C for choice, those are the advantage plans through a number of presidents. That's still in there today. Those are the private managed care companies. There's a lot of bias around them. For some people, they're excellent. And for some people, they actually do not like to have those, but they're much less expensive. And so New York is one of the few states where you can actually switch from an advantage plan to the more expensive plans without ever having health questions, underwriting, or pre-existing conditions. But Part C is an option that I do explain to people because it is a part of the solutions that exists. George W. Bush put into law prescription drug coverage. And certainly in this year, 2025 and 2026 upcoming, a lot of changes going on prescription drugs that I will speak of. Um, from a financial planning perspective, Chris and his team work a lot on making sure that you know and are able to sort of estimate the healthcare costs that you may have. But it's not just healthcare costs, it's really dental, which comes up a lot. And then there's the drug costs that come up. And the drug costs are a big part of the changes that are going on, as I just mentioned. But these are top concerns of people. And that's why we do what we do, educating people every day. The average cost of healthcare in America is about 11,000 per year, man, woman, and child. We spend about $4.5 trillion on healthcare in the United States, which eclipses a lot of the gross domestic product in many third world countries. The next 2 points are important. 50% of all medical costs in America are pre-diabetic care or medications. And poverty and racism accounts to over 60% about all healthcare in America. 63% people consider this decision to be their number one concern, and new and existing enrollees worry that they will get this decision wrong. Um, it's interesting. Social Security has gone up on the average over the last 30 years of 2.3%. Medicare Part B, on the other hand, has gone up by 5% over the last 30 years. This year, Part B premium is going up 11%, folks. And so that is not reflected in that number, but over the last some changes in 2023 and 2024 that are worth mentioning. One is the insulin cost cap of $35. That has made a huge difference because there are a lot of beneficiaries who are trying to manage some level of diabetes. Also, free vaccines, whether it be pneumonia or shingles, and others. These are free recommended vaccines covered by Part D prescription drug plans. And that's made a big difference. A lot of controversy on vaccines in general, but a lot of them are free. In 2024, it expanded what's called extra help, which based on income and resources, people were able to save money on prescription drugs, whether it be premiums, deductibles, or co-payments. And so the eligibility changed so more people can qualify. But as many of you probably know, negotiated drug prices occurred, and there were 10 in 2025, and there's more in 2026 that are coming in terms of negotiation by the government to Medicare, and of course, positive changes that are coming about. But the Affordable Care Act, Medicare is at its crossroads, and there are a lot of political considerations that are going on now. I don't think any one of you would not agree to that. But the current administration has sort of looked to reverse some of the last administration's impact on the Affordable Care Act. For people under 65, for people who are getting subsidies, this is a big deal. Huge numbers of people were able to enroll, have health insurance, maybe get subsidies, but the future impact is uncertain. These drug reforms that I just mentioned, rolling back some of the previous administration's policies to curb drug costs. Again, the new administration has put in, Trump RX, and pharmaceutical companies are buying into that. We don't know. We don't know whether it's going to help. It's not going to help in 2026. I can tell you that because the pricing for Medicare prescription drugs are already set as of October 15th, which is just a number of days ago. But there are negotiations that are taking place, and there is new medications that are being lowered in prices. But some of these remote hospitals, 30% of all rural hospitals may close because of the impact of the new bill. A lot of these facilities count on Medicaid money, and without that, they cannot survive. So these hospitals that are monitoring legal challenges and facing huge funding cuts that could, in fact, coverage in many, many areas of the country for patient care. But health insurance is different for everyone. If you're on group coverage, you have your coverage from your employer. If you're on Medicare, you have your Medicare coverage. If you have retiree coverage and you're retired, you have that. So it's different. It's different because people have to look and compare their group coverage or their retirement coverage to what Medicare offers. I often look at benefit summaries of current plans or offerings in retirement to determine which is better, Medicare or not. Many times when people are offered a retirement package through their school district or through the government, they may never get it back. But they also may be paying more than they thought, and they may not like the coverage. So it's important to evaluate it. But it's also important to evaluate how much people use their coverage. What is the cost for the employee? What is the cost for the spouse? Is there a child on it? Are there savings going on to Medicare? That's to be determined. How often are people utilizing it? What is the copays? What is the deductibles? What is the out-of-pocket maximums? Without looking at that, or maybe people are healthy and they haven't needed to look at that. But as they approach Medicare and as they make a decision on whether to keep their company coverage, those are the pieces that are important. Because as the transition from retirement to Medicare happens, someone needs to sort of pull all the pieces together, just like a financial planner does. We do as well. We want all the facts, we want all the information, we want to educate you so that you make the right decision. Especially in New York, you can change your mind year to year, but in other states, you can't. And the impact of the first decision is often the important one. But these vary by state. So if you're traveling, if you're staying in a state, if you just visit another state, all these things are important. Some vary by state and some vary by county. So all important. People too often, in my mind, stay the course. They're afraid to change when change is really needed or helpful, but they also don't necessarily trust the folks that are out there who are supporting this business and industry. And that's where my relationship with Chris and his firm and financial planners in general is so valuable. But each year, it's important to really evaluate your coverage, see if it's the best fit for your current budget and your current health. Is Medicare automatic? The answer is yes and no. If you're collecting Social Security before the age of 65, you're automatically getting a Part A and B card at 65. But if you're working for a company of greater than 20 employees, you do not need to accept Part B. You can send it back and just have Part A. Part B is going to cost you money, and the government is very happy to take that money. But if you're working for a larger company, greater than 20 employees, then you don't need it. Now, you may want to have Part B because you don't like the group coverage. That's another conversation. That's where this screen is so important to the people we work with, because this is where the confusion is. Do I get Part A? If you have an HSA, a health savings account, you cannot have Part A. People love their HSAs. And so it's one of the questions I ask is, do you have an HSA? And if they do, and they want to keep contributing to it, they can use it later on. If they want to keep contributing to it, they need to not get Part A. But after age 65, you don't have, maybe you have A, but you don't have B. That's when you need to be proactive to either get A and B or Part B at age 65 with a company of over 20 employees. So it's unemployed, self-employed, or working for a company of less than 20 employees. You must get Medicare at age 65. Some people don't, and they actually wind up with the penalty or issues with billing. So a big important piece. Original Medicare, just A and B. A, in almost all cases, is premium free. There are people who are coming from other countries that can buy into Part A, but as long as you or your spouse has worked for 10 years and 40 quarters, you actually don't have to pay for Part A. That's the inpatient hospital care, skilled nursing, hospice. Part B, on the other hand, does have a premium. This is for your preventive services, your doctors, your specialists, your diagnostic tests, your durable medical equipment. All of this is Part B, and there is a premium. Original Medicare covers 80% only, which is why there's a supplemental plan that's needed, and it does not include drug coverage. So again, basic information, but confusing. Original Medicare also doesn't cover everything. It doesn't cover dental. It doesn't cover care at home. It's limited in some cases to skilled nursing, um, meal delivery, acupuncture, hearing aids, personal care. Um, some of the Advantage plans that are out there, which is Part C and D, cover some of this, which is why people are often attracted to these Advantage plans. The enrollment periods. Again, some of you may be on Medicare now. That 7 month window is the window that people look at. 3 months before the month of the birthday, the month of, and 3 months after. But that's really applicable to people who are self-employed, unemployed, or working for a company of 20 employees. Other than that, people call, we guide them. If they don't have an HSA and they're anxious, we tell them to get Part A and call us again when they retire. The open enrollment, these are for people who are on Medicare now. These are people who are evaluating their Medicare plans, looking at notices that are coming in the mail. It's called an annual notice of change. They're looking at that, they're reading it or they're not, but this is the time of the year when everyone should be reaching out to their broker and saying, what's changed? Should I stay the course or can I make a change? Can you help me? The open enrollment period is another period where it's not known or marketed, but from January 1st to March 31st, you can actually still make a change. More the Advantage plan to the Medigap side without any questions, especially in New York. The special enrollment. This is for people who are retiring past 65, whether they have Part A or nothing. They can actually move anytime they decide to retire over to Medicare, and they have a special enrollment. But there are other special enrollments, though the loss of employer coverage is certainly the most common. There's the extra help, there's moving out of the state or the county, um, and there's FEMA, there's hurricanes, there's floods, there's fires. Those are FEMA-related special enrollments. They give people a chance to still make a change to their plan mid-year. So those are the enrollment periods. If someone has Part A and they're looking for Part B and they're retiring, there's two forms that need to be filled out. This is a Part B request form, and they put down in the remarks section, I'm requesting a Part B effective date of January 1st. Done. Sign it, done. This form is from the employer themselves stating that they had credible coverage. These two forms get faxed to the Social Security office. We've done it for hundreds and hundreds of people. And then we get you Part B. Again, this is assuming you have Part A. This is filled out by the HR department when you've given notice, when you know when your last day of coverage is. People often aren't sure when their last day of coverage is. It could be the day in which they give notice. It could be the 60 days later. That's important because you don't want to start paying for Part B, because the cost for Part B is at least $185 a month. So that figure of $185 a month is going up to $206.50. That's another 11% increase. So that number of 212 is going up to 218 in 2026. But you can see from these brackets that if your income from 2 years prior, it's looking at in 2025, it's looking at the 2023 tax return, line 11, or for your federal tax return. If that number is above any of these numbers or in this bracket, you can see that you will be paying more than the baseline of 185, and it goes up fairly high and fairly quick. But there is good news. The good news is that there is what's called a life-changing event form. This form allows you to sort of estimate the current year's income. So if you're retiring in 2025 and 2026, your income is dropped because you're no longer getting payroll, you fill this out, you estimate the bracket based on that. So if you drop one bracket or two brackets because of a lower income estimated in the new year, then you fill out this form and they reduce it. So there are four options when it comes to Medicare. There's stay with your employer group plan or your retiree program. We've evaluated it, you like it, the premiums are good, maybe they're helping you for it for the rest of your life, keep it. We'll guide you to keep it, absolutely, because you may not get it back. Original Medicare, risky. 80% coverage, 20% is out of your pocket, plus there's no Part D plan. The Advantage plans, a lot of bias, a lot of people are on it, but again, in New York, Connecticut, Massachusetts, and Maine are the only four states where you can switch from an Advantage plan to number 4 without any health questions. The Advantage plans are HMOs or PPOs. PPOs are more flexible. These premiums are near zero. They could be $40, but they're low compared to number 4. So an Advantage plans has some dental, has some eyeglasses, potentially has some over the counter, maybe some hearing. And these plans work for a lot of people, especially those who actually don't have chronic conditions. Number 4 is the best plans in America. These are called Medigap. These plans are pricey in New York, less expensive in other states. So if you move from New York, people call us before they move. But these plans in New York have gone up. They've gone up again about 11%. The average was 4%, but now it's up to 11% based on changes that are going on in the industry. These plans do not include a prescription drug plan, so one needs to add that to it. But the reason why people like these plans is you can go to any doctor you want anywhere in the country that takes Medicare. In the New York area, the cost for these plans, there's one plan that's $90, and then there's other plans that are $300 and $400 a month per person. So they get expensive, but again, the flexibility of doctors and no pay as you go, you know what you have, and based on affordability, many people go in this direction. But it's all about education. I come back to education all the time. Someone's looking at an Advantage plan, and we look at all your doctors, we look at all your meds. The Advantage plans work for a lot of people. They're private insurance companies, but they're a bundle. They include the ancillary benefits like gym membership and dental and vision, and they're very low premium. A lot of the country has a zero premium plan in your area, but you pay as you go to the carrier. The Medigap plans, on the other hand, small deductible, higher premium, um, and you can go to any doctor in the country that takes Medicare. Minimal friction, maximum flexibility, but no drug coverage. The prescription drug area is the single biggest set of changes in the industry. The Inflation Reduction Act created havoc in the industry. Inflation Reduction Act has nothing to do with prescription drugs. On the other hand, one of the things that was put in there is that in 2024, the maximum amount of pocket for any Medicare beneficiary was $8,000. In 2025, it went down to $2,000. That single sentence alone completely changed the industry. So now the insurance companies, CMS, and you are all being impacted by price changes. There's still negotiations going on, but that $2,000 is going to be $2,100 in 2006 is for many, many people a game changer. So if it's a Medicare approved drug, 2,100 in 2026 is the most you can lay out of pocket. And so for people who are on expensive brand name medications, that's incredibly beneficial. But depending on the pharmacy that you go to, the pricing is different. There's preferred pharmacies, there's standard pharmacies, there's mail order. And then there's these options. There's Good RX, right? There's Single Care. There's Canadian Store, which is actually out of Florida. There are these options that are available. And we help people with this. There's also international pharmacies that are available. So again, as I look at the clock, should I keep going, Chris? Tell me.
Yeah, I would say keep going. I don't have any questions in the chat yet, but everyone, you are welcome to ask some questions in the chat. But I would say, yeah, maybe another, 5 to 10 minutes more.
Sure.
Yeah.
So the dental piece is often something that people are shocked that it is not covered in any way except on an Advantage plan. And even on the Advantage plan, because of what I just said about the Inflation Reduction Act, the benefit of dental is going down. And so it could have been 2,000, now it's 1,500 or even lower. Some of them just offer cleanings and x-rays and don't offer anything that's comprehensive. Many people say they're going to the dentist. Many people do not. It's critical though. Many people think this is non-essential. You can't be healthy without good, sound oral health. Dentists are often able to detect things like cancer, diabetes, heart disease. And I'm a big fan of dental coverage. If you have a Medigap plan or if you don't have coverage at all, you can get it any time of the year. Doesn't matter what age you are. But also, if you're coming off of a group plan from your company, you can often keep that dental coverage as a standalone and pay whatever the premium is. But at least you know your dentist takes it or they're billing for it and you have some dental coverage. It's not cheap. And the expensive services, which are these on the right, these are the implants, the bridges, the crowns, right? The dentures, all of these are covered really at 50%. So even though people often say that there is not good dental coverage out there at all, the expectations are off in that, yes, on the left side, you see the cleanings and the x-rays. Well, that's free. The basic services might be covered at 20%, but the major services are covered at 50%. And so that people know that they have to come out of pocket, but having some dental insurance is better than not. You're also possibly paying less at the dentist for a service that is covered by, so they can sort of change the pricing on you to some extent. There is a whole new program that's out there around dementia. It's called Guide. This is a pilot program. I support the Alzheimer's Association. It's the biggest risk for healthcare for caregivers in this country. But this is a program that's really about a comprehensive plan. There's about 300 Guide approved organizations in this country. There's about 30 in New York that provide not just the regular Medicare services, but the things that are listed on the bottom: the assessments, the caregiver support, the respite for the person who's caregiving, and the coordination of this. That is really where that's important and makes a big difference. Hearing, underappreciated, not addressed. Often people are waiting too long until they're socially isolated, but there's a lot of stigma around it. Millennials, Gen X, Boomers, they have a stigma around hearing aids, but they should be seen as normal. Um, there's a lot of loneliness, isolation, and depression that come out of not hearing. It increases falls, but improving social engagement keeps people who are seniors more alive, more active, and a quality of life. And so, even though hearing aids are expensive, and yes, there's over the counter, but I recommend strongly people going to an audiologist who really knows what they're doing, giving you the right tests. And it depends on you how social you are. If you're going out and listening to music, or if you're going and sitting around at a dinner table, these are two different kinds of hearing aid options that are out there that have a different price tag attached to them. These weight loss drugs, major, major conversations going on right now. Even though it's a $2,000 out-of-pocket maximum, there's still a matter of whether these are approved by Medicare. And so it used to be all for only for overweight people who are diabetic, but now it's increased so that cardiovascular issues and sleep apnea are giving people a chance to actually get some of this approved. The prices are going to go down. There's been a lot of news about it. I think Dr. Oz is talking about it, but this needs to come down. There's a huge number of people. I just don't know what the impact of taking these medications are for the long term. I think that there's not enough research that's been done about this, but the fact that it might begin to get approved by Medicare is a big deal. So how do you prepare? How do you, Chris, prepare your clients? How do you as individuals prepare? It's really knowing that there are changes that are taking effect, and to review and compare your plans during this time frame, October 15th through December 7th. This is it. Um, what suits your needs and health and financial situation. You all get something if you're on Medicare called an annual notice of change. Look at it. Uh, it's subtle changes. It could be the difference of a copay or a copay going to co-insurance. But seek independent advice. You know, lower premiums may mean higher out-of-pocket costs. So really evaluate it. Look at your utilization. Compare the deductibles, the copays, and whether your doctors are in the network. Technology is coming, folks, whether it be us or Medicare.gov. Technology is coming. We are helping people with technology and moving forward in that direction because we have to, just in terms of even just drug runs. We are utilizing AI and we are poking around in it. Our support mission as a company is to provide the expert guidance. I love doing these webinars, but we're always 100% unbiased and objective. I deliver these virtual and live seminars and webinars all the time. My team gives comprehensive consultation services at no cost. There's no cost for our services. We get paid by the insurance company, but we are friendly. We are experienced. We are knowledgeable. We love what we do. But one has to recognize the importance of knowing your plan's potential costs. I don't care if it's a group plan or if it's Medicare. You need to understand your plan. It's important. Recognize the importance of the integration. But I also say advocate and appeal in big, bold letters. People often don't advocate for themselves, don't appeal their bill. If there's fraud, yes. If there's still billing mistakes, advocate and appeal. Get objective information. Look at these options during this open enrollment season. Medicare decisions happen at 65. Many people work past 65, but some people just want a quick answer. And then there's, of course, retirement. look at your doctors and meds, chronic conditions, different than just simple conditions. The Advantage and the Medigap plans. These are the choices outside of keeping a group plan, and find a trusted Medicare resource. That's the presentation. There's
Thank
always
you,
more to
Mark.
there's always more to come, but thank you so much.
Yeah, thank you, Mark. I think it's so important to go over all the different layers here because I think most folks might think A and B, but as you can see, there's a lot of different components. So thank you for going through that. And obviously, everyone, Mark's information, you could scan the QR code there, take his phone number down. If you want a personal introduction, that's something we're happy to do. We do have a question.
Yep, I see
Uh,
it. I will be happy to answer it. So if one's retired and still covered under their spouse's coverage, I'm assuming that they're still working. Um, okay, and they're working for a company of greater than 20 employees, I'm assuming. Then getting Part A could happen at any time. If they're not still working, then that's a potential penalty issue. But if they are working and the company is greater than 20 employees, there is no particular rush to get Part A, but you can, if you're nervous and want to just say to your friends and neighbors, you have Part A, I can certainly send you the instructions for getting Part A only, and you won't necessarily need it. But I'm assuming that they're still working and the company is over 20 employees.
Good question. Any other questions? Feel free, send them in. Wait a minute or so. Mark, do you see in your experience people getting penalized for missing
I
that?
do not. Again, I just got a call from an attorney who I met, and working for a company that decided they were going to cover his healthcare forever, and they never got Part B. And I had told them when I saw him a few months ago, that that was a mistake, and so I have an idea on how to eliminate the penalty. But the people that call us and who know that they can call us get information early on, and they, very rarely do I see a penalty invoked, but it certainly happens, and we hope we can prevent all of them from happening.
Yeah, absolutely. All right, well, everyone has Mark's information, so you can feel free reach out to him directly. Like I said, if you'd like a personal introduction, I'm happy to do that as well. And I just want to thank you, Mark, for taking the time to share this information. I think it's so important to see it, but I also think just like financial planning, you have to sit down, get into the weeds, and really customize it for your personal situation.
Right. Exactly. Thank you, Chris. Thank you for the opportunity to educate your clients. And happy, again, my services are free, and happy to provide answers.
Thank you. Thanks, Mark.
Thank you all. Have a great day and a great fall season.
Thank you.